You know how medical dramas love to push the boundaries of reality? Well, what happens when a real doctor fact-checks one of the most unbelievable cases you've ever seen? Today, we're diving deep into a classic episode of House MD with an actual OBGYN, Dr. Mama Dr. Jones, as our guide. We're going to separate the real, groundbreaking medicine from pure Hollywood fiction. So let's get into it and see what's real and what's just for the cameras. So the episode kicks off with this absolutely terrifying scenario. A pregnant photographer is on a shoot, and all of a sudden, she shows the classic signs of a stroke. Her face is drooping, her arm goes weak, she can't speak properly. It is a super dramatic start, for sure. But it immediately makes you wonder, wait a second, can that actually happen? And believe it or not, the answer is yes. According to Dr. Jones, it's really, really rare, but the risk of having a stroke is actually higher when you're pregnant than when you're not. Basically, all the hormonal changes happening during pregnancy make your blood clot more easily. That can lead to strokes and also things like blood clots in your legs and lungs. So, as shocking as it is, the show's whole premise is actually grounded in a real medical possibility. Okay, so the patient is stable, and now House and his team get to work. But, this is House, so the path to a diagnosis is never a straight line. It's a maze full of misdirection and totally baffling symptoms. And it all starts with kidney failure.
So the first logical suspect is something called HELLP syndrome, which is a really severe form of preeclampsia. And the name itself actually breaks down what it is, which is kind of neat. H stands for hemolysis. That's where red blood cells get destroyed. EL is for elevated liver enzymes, and LP means a low platelet count. Dr. Jones says this would be the obvious thing to check for, but of course the show rules it out pretty fast to keep the mystery alive.
So, with that off the table, the team pivots to a much, much more obscure theory. House figures out the patient must have had untreated strep throat at some point, which he thinks led to rheumatic fever, and that in turn could have damaged a valve in her heart, which caused a clot, which led to the stroke, and also caused the bad circulation that made her kidneys fail. I mean, talk about a winding diagnostic path, right? So to fix this supposed heart issue, they do a procedure and keep an eye on the fetus's heart rate, and it spikes to 208 beats per minute. Dr. Jones points out that this is, quote, way too high, since the normal range is more like 110 to 160. But she also says that temporary spikes like this can be normal. It's kind of like how our heart rate goes up when we exercise. The real danger is if it stays that high for too long. Okay, so the team gets the fetal heart rate under control, and they successfully fix that heart valve. Everything should be solved, right? Nope, not even close. And this is what makes the show so great. The patient's kidneys are still shutting down. House's big, complicated theory was a complete dead end, and the real problem is still a total mystery. All right, so they've run out of leads on the mother. And this is where the case takes a really dramatic, highly unusual turn. The whole focus of the investigation is about to shift from one patient to another. And then you get this classic House moment. He just declares that the mother's body is working fine, so the problem has to be with the other body inside her. This is the big pivot point. The team isn't treating the mother anymore. They're trying to diagnose the fetus. House's new theory? Something called maternal mirror syndrome. It's a condition where the mother's health basically falls apart in direct reflection of a problem with the fetus. And to give you a sense of just how obscure this is, Dr. Jones, a practicing OBGYN, remember, says she had literally never even heard of it. This is where the case starts to go from medically plausible to exceptionally rare. Now, to confirm this, they need a clear MRI of the fetus, but it's moving around too much. So what's their solution? An incredibly risky procedure to paralyze it. Dr. Jones explains just how insanely hard this is in real life. You have to guide a needle through the abdomen, the uterus, the amniotic sac, all to hit a tiny, floating, unanchored umbilical cord. It's a moving target, and the risks are just huge. But this crazy gamble actually pays off. The MRI reveals the true source of the problem. The fetus has a severely blocked bladder. It's like 4 times its normal size, and it can't urinate. All that toxic backup is getting mirrored in the mother, and that's what's causing her organs to fail. So, with a diagnosis finally in hand, the team moves into the most dramatic part of the whole case. They start attempting procedures that really blur the line between cutting-edge medicine and pure medical fantasy. The team performs a fetal surgery to put in a tiny shunt, which should let the fetus's bladder drain. And for a second, it seems to work, but then the mother's condition suddenly gets way worse. Her liver starts to shut down, and the whole case is just thrown right back into chaos.
And this leads to an impossible choice, a true ethical nightmare. The only guaranteed way to save the mother is to deliver the fetus, which means ending the pregnancy. But at only 21 weeks, the fetus can't survive outside the womb. The patient refuses to terminate, leaving the team completely stuck, with 2 lives hanging by a thread.
So, to try and convince the patient, House resorts to his signature brutal bedside manner. He actually dehumanizes the fetus, calling it a tumor, all in an effort to force her to consent to terminating the pregnancy.
Dr. Jones's reaction to this is swift, and it is direct. She just flat out calls it a ridiculous thing to say, and she points out how completely unacceptable that kind of language is from a doctor. It's a perfect example of where that TV drama just smacks right into the reality of patient care. Unwilling to give up, House proposes a total Hail Mary pass, an experimental open fetal surgery. The plan is to literally open the uterus, partially take the fetus out to operate on it directly while it's still attached to the placenta, find the problem, fix it, and then put it all back. It is about as high risk as you can possibly get. This brings us to the climax of the episode, a resolution that pushes way past the boundaries of what's medically believable. This is where the show goes full-on Hollywood. So during the surgery, the mother goes into cardiac arrest. They have to defibrillate her while the operation is still going on. And yet, against all odds, they find and fix the problem in the fetus's lungs. And in the end, everyone is perfectly fine. A miraculous 100% recovery for both mother and baby. So what's the real doctor's final take on all this? Well, Dr. Jones does not mince words. She calls the entire scenario highly unrealistic and dangerous. She says that while fetal surgery is a real thing, this kind of experimental, cowboy approach in the middle of a crisis is just not how medicine is or ever should be practiced. And this right here is the key takeaway. Dr. Jones argues that this kind of portrayal of medicine isn't just flippant, it's actually harmful. It creates this false belief that some brilliant but reckless doctor can just throw all caution to the wind and pull off a miracle. In reality, she says, acting like that is far more likely to make things worse, not better. Medicine isn't about just hoping really hard for a miracle, it's a calculated practice of weighing risk and benefit. And so, ultimately, breaking this all down leaves us with a really critical question. We all know shows like House are super entertaining, but we have to ask what kind of impact they have. Do these stories of medical miracles offer people hope in desperate times, or do they set a dangerous, unrealistic standard that real doctors and their patients can never ever hope to achieve?